There, good. I'm recording. I want to introduce Dr. Kimberly Palmer Yee. She is a co-owner with her wonderful husband at Twin Lakes Chiropractic since 2005. She did her undergraduate studies at University of Alabama, Alberta, sorry, not yet, roll tide. University of Alberta, sorry. Receiving her Bachelor of Arts and Science degree, she received her Doctorate of Chiropractic from Western States Chiropractic College, which is in Portland, in 2000. Her practice philosophy emphasizes chiropractic health care for women during pregnancy and childbirth, and chiropractic care for infants and children. Full spectrum family chiropractic medicine has allowed her to establish strong family relationships by providing maternity care for moms, caring for babies and children, and even their grandparents. Dr. Palmer Yee is also a certified yoga instructor. Her students learn the importance of good body mechanics and the benefits of having a strong spine and core. Dr. Palmer Yee, along with her husband, Dr. Edward Yee, keep busy with 3 young children in her spare time. She enjoys exercising, volunteer work, and spending time with her family. If everybody would please give her a round of applause right now.
Thank you.
And with that, I am gonna mute everyone except Dr. Palmer. And then Dr. Palmer Yee, then you can do questions at the end, right?
Yep.
Okay, so I'm gonna mute everyone, and then let me see.
I'll unmute me. There.
Yeah, you can unmute yourself.
Oh.
Okay, you ready?
I am ready. Can I share the screen?
Yes, I think I set it up where you could share it.
There we go. See it?
Not yet.
I don't know what that is. What is that? It's asking. I've never done this before, so let's see. I may have to have you share it. I don't think it's going to let me share it. It's not letting me cooperate.
Wait a minute. I'll make you the host. Hold on a second.
You know what? You can share it, and I'll just point out. There's only one screen that we needed the mouse. It'll work.
Try it now.
Share it. You know what? Because I've never done it, it's not letting me. So you just share it so we can move on. It'll be fine.
Okay, let me go bring it up real quick, and I can do that. All right, hold on a second.
All right, well, Diesta does that. Thank you for having me. As you just figured out, I've never done this before. So she challenged me. I had to take a YouTube tutorial to figure out how to do PowerPoint. There is a lot of information on these slides, and we're not going to be going over all of them, but they're there for you to read and to take a look at. Please feel free to ask me questions. If you have a question after this presentation, feel free to reach out to me. But I love serving people. I volunteer a lot. I love helping people live their best life. There we go. So there's our slide. We're going to talk about, there's a lot of science in some of these slides. So we're going to dive into bone health, joint health, muscle health. We're going to talk a little bit about nutrition, but nutrition dealing really a lot with bones and joints. We're going to talk a little bit about exercise, but we'll get to it when we get to it. Okay, next slide. So this slide is my why. This is my husband and my 3 kids, his first day of school, and this is my little deaf dog. As you can see from my back screen, I'm actually originally from Canada, and I have not been home in over a year because the borders are closed since March. But my husband and I have been married for a long time and been practicing together a long time. My oldest, which I've known Diesta for a really long time, and her son is graduating from college. I mean, my son is driving. It's shocking how fast I found myself now in perimenopausal time. And so all of the previous presenters have really given me a lot of information. And I hope that at the end of this hour, you feel like I've given you something. So moving on this is a challenge. This is a rest of your life challenge. I live a life of gratitude, and we're going to live our best life. And you need to do that if you have a lot of information. So I'm going to empower you with all this information so you can navigate your own midlife map. And everybody's map is going to be very different. The adventure that you're going to take and you have been on is going to be different than, and I would say, the person beside you or the person to your right or to your left. But in Zoom world, we're going to say the person above you and the person below you. So your adventure is going to be different than everybody else. It's probably going to be different than your sister or your mom or even your grandma. So we're going to navigate this together. Again, we're going to talk about bone health, joint health, muscle health. I'm going to develop strategies that you can take to living your best life. Moving on to slide 4. So here is...
Hold on, we're thinking about it.
Well, here's where there's a lot of information. So once we get to it, you can start reading it. But this is the human body. And we are built from elements, from cells, to tissues, to systems, to organs. And then we've got bones and muscles. But there's a lot of information in here to kind of take a look at, just to know that everything affects everything. And what I say in my practice was, you sprain your ankle and your back hurts. Why is that? You didn't hurt your back when you rolled your ankle, but you suddenly start walking differently, and that affects your back, or that may affect your neck or your shoulder. So your little finger is connected to your little toe. Muscular, but even estrogen affects bone growth, and we're going to talk about that later on. But there's a little fun fact at the bottom, is that in 14% of the population, missing the palmaris longus muscle. So I'm going to have everybody, you can stay seated. You're going to take your thumb and your little finger. And there's a tendon here, that's the palmaris longus muscle. It's actually absent in 14% of us. It doesn't change your quality of life. It's just some interesting little fun fact. Some of us have extra vertebrae. That doesn't mean that Shaquille O'Neal, who is extremely tall, has extra vertebrae. His vertebrae are just bigger. But those are anomalies that we all have that all makes us unique. So moving on to slide 5. Why are we developing pain? And often when we get to this age is, why are we starting to develop pain now that we didn't have when we were 20 or even 30? And it's really becoming now accumulation of all that stuff we did in the past. And a lot of it's postural changes. So many of you are going to start sitting a little taller. I always joke to my patients that you brush your teeth right before you go to the dentist, right? So when you walk into the chiropractic's office, usually you want to have good posture, and then take that wallet out of your back pocket. So often it's postural changes. We all sit now in front of computers. We all have those tablets, the phones. You look at our kids and we're starting to look down a lot more. But you see those grandmas in the grocery store who are all bent over, and they grew up in a time where they wouldn't spend so much time looking down. So I ask that we just all practice really good posture. Also, or change our exercise form. Oh yeah, I can still lift these 35-pound weights. Maybe not so much. Even our exercise technique changes. And then a change in stability. So I'm going to talk later on, and we talk, people in fitness say, oh, cardio, strength training, flexibility training. Let's get real. We also need to be really training for balance. And that's going to affect the body, but also our ability to prevent us from falling. And I have a full slide talking about hip fractures. Poor core activation. So as we sit here right now, how many of us are engaging the core? Pulling the belly button in. You really want to engage the core almost in everything that we do, but we don't do it. And then decrease in estrogen, weight gain. We've been talking about this. We all kind of start getting that little bit extra weight gain. Depression, life changes. There's a lot of big changes for us women in this time. Our babies are growing up. Our careers are changing. Right now, I have seen tremendous amount of uptake in depression of patients who feel really isolated the last 6 months. And this is a conversation that we need to be having on an everyday in our community, in our homes, but a national level. Like, what are we doing for mental health pre-COVID, but even now really living in COVID? And life catches up to us. So we're going to talk about, these are why you're developing pains, and I'm going to give you the strategies of how you're going to help yourself deal with this pain. So we're going to move on. So the big one, we all kind of hear it about as we get to this age, is why does the body develop arthritis? Now, there's multiple kinds of arthritis, and we're only going to talk about the osteoarthritis or degenerative arthritis. But you can have both. You can have rheumatoid arthritis, psoriatic arthritis. Those fall into the inflammation arthritises. Here, we're going to talk about osteoarthritis. And this is going to be stress. And not just physical stress, because I see arthritis in 20-year-olds, because we're abusing our bodies then. A lot of truck drivers have different arthritis than somebody who sits at a desk. So we're seeing arthritis, it's not really an old person disease or a menopausal disease, but arthritis is kind of what's starting to knock on our door here. So we're going to move on to, and this is a joint. So a joint is really a place where two bones come together. And there's a joint in every place in your body. So there's a little bit of anatomy here. I do have some x-rays, but there's cartilage. And I say that two bones come together and they don't just slam on one another. There's a nice pillow called cartilage that surrounds each of them. And then there's like duct tape that hold those nice and secure, AKA those ligaments. But they got some juice in there that make them all hydrated. That's synovial juice. Well, the difference between a healthy joint and arthritic joint is that they start to lose that joint space, as we can see over on the x-ray of the loss of joint space. See the difference between the normal joint space, and this is of a knee, versus the loss of joint space. And you can see that it's not even. There's a little bit more of that loss of joint space on one side versus the other side. There's also reduction of joint fluid, breakdown of cartilage. As soon as you'll hear the terms, oh, I'm bone on bone. And then your body reacts by developing little osteospurs. So that is what it's trying to stabilize the joint. And we see it a lot in spines where the joint starts to become unstable. And so the bone actually lays down additional bone that's trying to connect and fuse with the joint above it. And you can actually have full fusion. So this is what a joint is. We're going to move on to the next slide. And so talking about the physical stress is, you can see, and I kind of talked earlier about what happens when somebody sprains an ankle and it affects the whole body. Us with women, and I think we're all women here, is we were all taught, at least I was, my mama taught me, that you sit with your legs crossed. Well, what does that do? That creates an unleveling of the pelvis. We tend to, and I'm very right hand dominant and I'm very left hand dummy. So I carry every single thing on my left shoulder because I got to have the keys in my right hand. So I've created unequalness in my shoulders. I had 3 babies and I've always carried my babies on my left hip. So I've got my right hand free to navigate whatever I needed to navigate. Well, I've created an unleveling of my pelvis and leveling of my shoulders. And so what does the rest of my body have to do? It has to compensate. Now, I don't have any slides, but we can talk about a little bit of scoliosis. And we hear, oh, scoliosis, we test that in our elementary school kids. Well, there's really kind of 2 scoliosis. We're going to talk a little bit the compensational scoliosis. And this is what you see in our skeleton here, is that body changes in reaction to trauma. And trauma can be acute, oh, I just fell down the stairs, or repetitive misuse, overuse of that body. So take a look at that skeleton, because on the next slide, we're going to go into a case study. The next slide. So here is an x-ray of a 47-year-old woman. And if I was having my mouse, but I'm going to have Diesta kind of help guide me. So when I get films and we shoot at digital x-rays in my office, I don't shoot them on everybody, but it's a great baseline. So I can take a look and see, okay, I first count the vertebrae, and there's 5 lumbar vertebrae here. You can see my last rib, so I know that's my 12th rib. Then I take a look down at my iliac crests, AKA my pelvis. And this is actually me. So I'm looking at alignment, I'm looking at the bone. Is all the bones there? Is there any cancerous? And then is there any disease? Infection, arthritis. So looking, you can see that that left iliac crest is a bit higher than the right. She's a little willy wonky. Then if you were looking straight on the x-ray, you can see, you know what? She's kind of leaning a little bit to the left there. But the joint spaces, and those are spaces between each vertebrae, this shot look really nice. I call them nice and juicy shots. So now we're gonna take a look, same slide, over at the lateral view. And here you actually can see the disc spaces. Now, if I was concerned that this patient had a disc injury, I then would send them out for an MRI or a CT. The disc spaces look really nice, but you can see that the very last one, there's a little bit of a growth on the bottom of that. And that's the beginning of osteospurring. Also, taking a look in the side shot is that iliac crest. You can see the outline of one iliac crest, and then right below it, the outline of the other iliac crest. What that tells me is that this patient doesn't have a level pelvis. Her pelvis has gone once higher, and now it's rotated. Well, what's that gonna do to the rest of her body? Her body's having to compensate for that. So this is great information for me to say, okay, there's some lifestyle changes that need to happen here, but overall, her bone health looks really good. I don't see any osteopenia or osteoporosis. Her disc space like nice and good, nice and fat, juicy discs. Her alignment's off. I see no missing bones, which is often, it can be the case of some cancers, lytic cancers. And she might be diagnosed with early osteoarthritis, but I'd probably give her a pass on that. So looking at the x-rays, is there any questions moving on about the case study? Okay, we can come back to it. So next picture. So what can we do to prevent this? And I love to say to my kids, because right now they're sitting on a screen, well, all the time, but all the time with school, and then they get off that and then they sit on another screen, whether it's an Xbox or their phones, is that motion is lotion for your joints. You've got to move your body. And if that movement is even making you drink a lot of water, so you got to pee, but you got to move your body. You don't need to join a gym and get a trainer. You don't have to go to hot yoga. Just walking, and we're going to talk about that. But just moving your body in a natural movement is probably the very first thing that the best thing you can do for your body. The next is good posture. And I'm not talking about just sitting here looking at you, I've got good posture, but we're talking sitting posture. Don't cross your legs. We're talking standing posture. Stand in a mountain pose of yoga. So I'm bringing my yoga world into here, which is weight is equal on both feet. We tend to stand favoring one side than the other side. And then being aware that you can do the mountain pose. You can do this anywhere. I do it standing in line at Costco or at Target, where your weight is evenly and purposely and mindfully distributed amongst both your right and left foot equally. And then you're just gonna tuck that bum in under a little bit. You're gonna draw your shoulders over your hips, and then lastly, draw your ears over your shoulders. So now you have that nice long line of your spine. It's not a straight spine because you have normal curves, but that's a better posture than being here hunched over. So I encourage my patients to kind of open back. Now, we're not used to that. So you may have to be working on wall angels here along the back, anything to allow you to have that good standing posture. Now, sleeping posture. We all have a way that we like to sleep, and I am the worst. I like to sleep in my stomach, which is the worst thing you can do, but I have a good pillow for that. So sleeping on your side, make sure you put a pillow between your knees, because when you truly sleep on your side, you don't. You have one leg that kind of migrates over. What's that doing to your pelvis? It's rotating your pelvis. So I encourage you to get a pillow, not a fancy pillow, just any pillow, and start with it between your knees. It's probably not going to stay there. That's okay. As long as you start with it there, then you've got more time doing it, more time than not. Another thing is if you like to cross your legs, and that's a habit, cross the other way. It's not going to stay that way very long, but at least you started that way. or put a sticky note. I encourage my patients, and I have my kids put sticky notes, posture, just a friendly reminder. Oh yeah, need a little posture check here. But just be aware of carrying out your purse. First, we carry way too much stuff, and don't carry your husband's or your boyfriend's or your son's stuff. Make them carry their own stuff. But get a purse that you can, either a backpack that's secure, or maybe a crossbody purse that you can wear on both shoulders. Again, I like to carry my purse on this shoulder here, so I need to flip it over. And then we're going to talk about exercise, which is not a fun word for most people, but cardiovascular. You really want to get that heart rate up. You want to do strength training. One, your muscles need it, your bones need it, your joints need it. Work on flexibility, touching your toes. YouTube a yoga video for 10 minutes, but work on being able to get your flexibility, because again, use it or we're going to lose it. And then work on balance. And balance can be simply to standing against a wall and putting weight on the right foot and lift your left foot off. That's all. That's all you need to work on balance. Ideally, if you can do it barefoot, practice doing that 10 seconds on one side, 10 seconds on the other side, and do that a couple of times and build yourself up. That's all you really need to work on your balance. But balance is so important, and that's something we never talk about and we never practice. I have not yet been to a balancing class. We have yoga classes and we have strength building classes and cardio classes, but I've never had anybody say we need to work on balance. And then interval training, and there's lots of science out there right now that's saying interval training is so good for your body, for your muscles and your joints. And then walk every chance you can get. Now, we just had the tremendous amount of rain, so right now you're going, there's no way I'm gonna walk. Well, I have some of my older patients just walk around, set a timer, set Alexa or set your phone, timer 5 minutes, and just walk around your house. Go to the mall and walk, get on a treadmill and walk. Or when you're shopping, don't drive around for 10 minutes like my husband does to find the closest parking spot. Call it, park the furthest back, and walk to the store. And then again, ears over shoulders, shoulders over hips. The other thing that is easy things we can talk about is reducing the amount of inflammation in your life and in your diet. So eating a cleaner diet, and this doesn't mean you need to buy any books, but just eating real food. Have a real egg, having, real food that's not coming necessarily out of processed, already cooked in a box. So you just have to heat it up. Deal with, again, emotional stress. And right now we're starting that dialogue, mental stress, and then drink as much water. Now, I know Diesta just went to go get her water, but we all should be drinking as much water as you can. And what I tell my kids is that if you're peeing clear, you're doing pretty good on your water. And it's hard to say, you're going to say, she wants me to drink water. I spend the whole day in the bathroom anyways. Well, your bladder actually will train. And I know that somebody who I'm really excited because I got bladder issues is going to talk in a couple of days, but drink lots of water. And then look in your daily life at what's causing you extremely physical stress, whether it's your job, how can you change that? Is it your car, your seat in your car? Is it your bed? Is it your pillow? Like, what is not feeling comfortable in your life, and what can you do? And then, and this is something that we're all struggling with, but you want to make sure you establish and maintain good sleeping and resting habits. Now, rest is a bit different than sleep. Having resting time than from the go, go, go of your day. Taking time to sit and watch a Hallmark movie, and that makes you happy. Or sit and just, I like to putz around the house. I call it puttering around the house. But then really work on getting a good sleeping regimen of going to bed at the same time and getting up at the same time. And what do you need to do to stay asleep? Whether it's a sleeping mask, white music, different sheets, blacking out the room, but anything that is going to help you recover and feel better. Next slide. So what about the bones? So there's about 213 bones. And I say that because sometimes we actually have 3 bones in each ear. So that's 6 additional bones. And our kneecap is a sesamoid bone. And sometimes they don't count that in the encyclopedia of bones. So we have about 213 bones, depending upon who you're talking to. But we're going to talk about some bone health. Now, taking a look at the skeleton, she does not have very good posture. Her pelvis is misaligned. So moving on. So here, we're going to have a good dialogue, dive into some bone health. And I wrote some stuff down so I wouldn't miss it. But The importance of calcium and vitamin D is often not talked about or understood. And that's why our cereals are fortified with vitamin D. We have to have vitamin D in order to absorb calcium. And our body makes vitamin D naturally. But the caveat is that you have to have sun exposure to get vitamin D. And as we're heading into fall and into winter, they're finding that people who live in our climate and above don't get enough sun, real UVB, natural UVB, in order for our body to make vitamin D. So that's why often our food is fortified with vitamin D. And there's a little, you can talk, there's a lot of information, I'm not gonna go into it. Calcium, the best source of calcium is from your diet. And the best source of calcium in our diet is actually leafy green vegetables. Cheese is up there and milk, but leafy green vegetables like kale is the best source of calcium that we can get. So what else am I going to talk about? Now, hormones do affect bone. Reduction in estrogen actually starts to prohibit osteoblasts and osteoclasts. And now we're talking at a cellular level of how bone is made. So when we start to reduce our estrogen, our bones are having a harder time being regenerated. Now, what helps in that is weight-bearing exercises. And I have a couple of slides that we're going to talk about that. But just knowing that estrogen is not the end-all of be-all of osteoporosis. But if you are already at risk of osteoporosis and now you've reduced the estrogen in your life, that's a conversation that you should be having with your primary care physician. But there's other things that you can do is diet, weight-bearing exercises that will help as well. Okay, we're going to move on if everyone has read this, because we're going to talk about osteoporosis next. Oh, weight-bearing exercises first. So here's some good, easy, throw them in there. Walking. You don't have to run on a treadmill. You don't need to run, but walk, 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 walk. Now, I've had patients say, well, I like to ride my bike and I like to swim. Great, do that. But that's not going to really be necessary weight-bearing exercises, because you have to have weight-bearing exercises to stress, and I use that word really lightly, but stress those bones, challenge the bones. So yes, ride your bike, yes, go swimming, but also go for a walk. Then you can use hand weights, because we also have to work, walking only hits about mid-chest down. So you also got to do some planks, and some people, those are kind of naughty words, but I've showed you 2 variations of planks. They don't have to be high. You're not holding these for 5 minutes, but anything to challenge those shoulders, those wrists, planks. And then even you can use cans of soup, anything to challenge those bones is what you want to do for weight-bearing exercises. Now, I threw in this person here in yoga doing a chair pose. And this is something that we all need to be practicing. It's a functional exercise in our life, and it is training us for us. And this is a real problem as we age, for getting on and getting off the toilet. There's a lot of women and older men who have a hard time as they age getting on and off the toilet. So if we all started working on chair poses, that will help train those muscles to be able to get us on and off the toilet. So we're going to move to the next slide, which I think is osteoporosis, hip fractures. So osteoporosis is where we start to lose the bone. And we start, actually, women start losing that bone in their 30s and early 40s, sometimes 20s. A lot of diet is related to that as well as what happens with your mom. But what I found interesting, and Diesta and I talked about this, is that Caucasians and Asians are more likely to have osteoporosis than any other race. Interesting. To have hip fractures than any other race. So looking through this, hip fractures tend to be in older people, and they double with each decade after 50. And women are more common than men, and hip fracture, per osteoporosis and hip fractures are more common among women. A fall is the most common reason for hip fracture. So let's go back, let's go back several slides where we talked about balance. How important is it to be functional training our balance? So we're less wobbly, less chance to take a tumble, and less chance to break a hip. Another small percentage of hip fractures actually happen spontaneous. And that's where there's so much osteoporosis in those bones. those bones are broken down so much that they are weak, that actually when a woman goes to either take a step or to come up from a seated position and that muscle contracts, it actually breaks the bone. And then she takes a tumble down. So it happens, but it's less common. But I've shown you two kind of treatments that they do for for hip fractures. Is one, on my left-hand side is a full hip replacement. And it really depends where that fracture happened. And then the next x-ray you can see is where they've actually shown in and they've just got to put some rods in. But as we know that after a hip fracture, that's a lot of our older women, that is kind of like the beginning of the end. It's harder to recover as we age, but there's a lot of these require a lot of sitting, and then we're starting to throw clots. We start to lose our muscle, because we're not moving very much, our bones get even more osteoporotic. So I encourage us all right now to really have a conversation with yourself about how you're going to keep your bones strong. Because if you can prevent a hip fracture, you're ahead of so many other people. Okay. Any questions about hip fractures? Oh, I see a chat. Is that for me? Oh, that's yes. Oh, is that me? Let's see. Yes. So it's going to, so the question is, I don't know if you read it in the chat, is that Lori asked, can movement help a person with bone on bone knees? Yes. Now, did somebody just tell you you have bone on bone, or do you have any cartilage in there? What's the synovial fluid? Is it with your knees, as we saw from the x-ray earlier on? Sometimes it's just part of it that's bone on bone, but any movement can be very helpful. Now, can you get that cartilage back? There's supplements. It's challenging. It's going to be difficult, but the most important thing is you're going to stop that rest of that degeneration. And that is doable. But movement, even if your movement is that you walk across the room without assistance. Again, I have a patient who's 72 years old, and she was in a major car accident, and she's just walking for 5 minutes a day. And that's success for us right now. We just need to get her moving. In each week, we hope to add on to that. So any movement can be a good thing. Now, proper movement, obviously. So again, with that knee, is you want to be using the knee. So practice getting up from a chair, because movement is not just moving forward and back, right? There's some rotation in there and some lateral. So all sorts of functional movement can be really good for that. Okay, I think I answered that. Okay, moving on. So now we're going to talk about the muscles. So the body has about 640 skeletal muscles, and these muscles provide, and again, I've got a diagram over here, and you've already heard me say it because I say it all the time: use it or lose it. Motion is lotion. So you really want to use your muscles, challenge them, work on your strength, and you don't need to be lifting, 500 pounds, but whatever your strength is, do that. And so, there's a lot of hit stuff on YouTube. Our Diesta's got a plethora of information, but even using your body weight is still enough weight to challenge your muscles. Getting those quads and your hamstrings, your abdominals, your biceps, your triceps, your shoulders, your lats, getting those in challenge. Flexibility is really important, because we start to really lose flexibility because then we don't think about it. Oh yeah, I just went for a long walk. Well, how many of us takes that 5 minutes to stretch? And then functional movements. And this is where we're training for our life. And this is going up and down stairs. I know that a lot of people start to live in ranchers, and that's great because we're worried about stairs, but I still think there's still stairs in our life. The elevator may be broken, the escalator not working, and you're still gonna have to go up and down those stairs. So if you live in a ranch style house, I encourage you once a week, somewhere find stairs, go to the park, somewhere, and practice, work on going up and down stairs, and practicing from on and off the toilet. It is surprising how many older people have a challenge with this. Brushing your hair. We all want to be able to brush our hair. Well, when you're in pain, this is challenging for you. Dressing yourself. And we're not just talking all these just pants, because we can sit down, one leg, but practice, keep on doing zippers and buttons, because those are things that as we age, those finite movements that we start to lose. So you're also wanting not only to train for your heart, but also those functional movements that will help you in life. Okay, Fiesta, next slide.
Kim, can you make me the host? And some women are still trying to get on, and I messed up and made, so could you make me the host?
Yes, how do I do that?
So go up to my picture, and there's like a little box on my picture with the little
make host. There you go.
Yep.
There.
Okay. All right. Thank you.
See, look, I just learned something new. Out of my comfort zone completely with this.
All right. Great job. Great job. Thanks.
Okay. So moving on.
Yep.
Next slide. So now that I've given you all this information, is what treatment options are out there? Well, we're going to come back to it, but remember that midlife map. There's so much out there that you can do if you get yourself into some pain, or to help you along is chiropractic care, physical therapy, acupuncture, massage therapy, exercise-specific stretches, strengthening, functional movements, balance, cardio, ice and heat. I have lots of people who love to come in and they say, oh, I just put the heat on that. Well, you just sprained your ankle. Don't put heat on a new injury. So if you suddenly wake up and your shoulder hurts because maybe we raked too much yesterday, don't put some heat on there yet. Put some ice on there first, and then you can follow up with some moist heat. Something that's new, and it's not federal, and there's some states that are really specific about that, but is some CBD creams. And I have done some research. I've just started selling them and offering them to my patients, using them on myself. 2 years ago, I took a tumble. I tripped over my own feet at my son's school, and I dislocated these 2 fingers. And the PE teacher actually stopped my head from hitting a wall. So, and right there, I reset them myself. But I had some incredible swelling and pain. I did brace them. I'm right-handed, so it was really painful, really, really painful in the rest of my life, how I compensated for that. But after about 9 months, I still had this residual achiness. And I really couldn't play the piano as much as I wanted to. And I'm not a very good piano player. So it probably wasn't a tragedy for my family, but I just had that achiness. So I researched it. I started using some CBD creams, and that achiness, that chronic kind of pain actually went away. So that's where then I became a believer in it. Knowing that with CBD creams, it does not affect the bloodstream, because I do have some patients who are worried about failing a drug test. It actually goes through the neurological pathways. But I encourage you, if you are thinking about taking CBD creams, and this is not, I'm not talking oral, I'm talking about ointment, is that talk to a provider who sells it. Because you want to make sure that you're not just buying it, and I'm not going to say any major company stores, but you want to make sure where it's sourced from, of the purity of it. Or BioFreeze, Icy Hot Bengay, it's all going to help those muscles feel better. Ibuprofen or Tylenol, and then even prescription medications are always treatment options. But I'm always just going to go back to is living your best life, and how can you functionally get stronger? How can you deal with these aches and pains that you have kind of been neglecting or abusing your body for the last X amount of years, and it's kind of catching up to you? Well, it's not all over, but you're going to have different strategies as how, one, you're going to change whatever got you there, and then how you're going to get better with it. So these are just some treatment options. There's a plethora of other treatment options out there, but these are just things that I have a full conversation with my patients. I have patients who go to physical therapy and then come to us. I've seen an acupuncturist. I send patients out to acupuncture. Chiropractic is not the end all. It doesn't help everybody. When you have that bone on bone, sometimes you may need to get that knee replaced. Chiropractic can only help. So if you can't help yourself, I can help you. So I do put a lot of responsibility on my patients. I don't prescribe any medication. So those patients who are really looking for the pill, like I'm going to ask you to do a lifestyle evaluation. Any questions? I saw a chat come in. Aspartame, yes. So Lori said that CBD didn't work for her, but aspartame worked better. Yes. There's valerian out there. There's a whole bunch of other different things. You have to find the thing that works for you. Sometimes you have to also give time for the aspartame to work. Give time for that icing treatment to work. Give time for chiropractic care or physical therapy to work. It's not just a magic cure-all one day. Again, it's a little bit more, but yes, that's why you have to kind of try trial and error what works for you. All right, moving on. So we're coming back to the midlife map. So deep, yes. So somebody just said in a comment, Deep Blue by doTERRA. Yes, that's another great one that we use as well. So back to this midlife map that we talked at the very beginning. So first of all, you're not alone. You have a plethora of different strategies to help you guide this midlife. And it's really going to be your life, your adventure, your journey. But there's a whole bunch of other different things you can bring into how you're going to live your best life, whether it be chiropractic, functional training, physical therapy, all of that. But I just put in here as kind of a reminder that it's not just one thing that's going to get us through this. It needs to be a whole bunch of other things. All right. All right. So now what? As I'm coming towards the end, is now I've given you all this information. So these are things that I try to remind myself. I try to remind my patients, and I try to even remind my daughter is that this is the rest of your life challenge. And you're not alone. Like, look at this fantastic community that Diesta has built. I am truly grateful for the fabulous information that I've already gotten. I'm not so sure if I'm happy about the challenge that she's issued me here yet, but maybe I will be in like 15 minutes. But you're not alone. And that's really important. I hear that the last 6 months, 7 months, people really felt alone in every aspect of their life, but we have to remember you're not alone. There's somebody out there, one who wants to hear, wants to help you, and is probably walking very similar journey as you are. And what I tell my kids every day, and I truly, when somebody says, how's it going? I'm living my best life. At this very moment, I want to live my best life because I don't know if I get tomorrow. The picture that is actually my screen, my green screen here, it's from my most favorite spot in the world. It's a small town in BC. It's called Nelson, and it's on my parents' wharf. And it's actually the picture that I took the morning after my dad passed. And my dad lived a full life, and he was diagnosed with cancer, and he spent those 7 weeks really kind of going through that checkbox. So he said, I live my best life. And he goes, there's no guarantees that I get tomorrow. So I took a lot from that. And that's why my, whatever this is, green screen thing is a reminder to that, is that every day I'm going to live my best life. And this isn't a dress rehearsal. We don't get a second chance. You don't get another go at this. And I love to say, train your body, your mind, your soul, your heart for living your life every single day. Even when it's crazy rain and light and thunderstorms, still live your very best life. And then I'm going to say it, move your body every day. Even when it's cold and it's wet and you just want to hunker down, make yourself get up. Set a timer, make yourself walk around every couple of minutes, every, 30 minutes a day, whatever it is for you, but do stop making excuses. I heard 2 days ago, I'm going to start walking when I get a Fitbit. Why, you can't walk right now? like what? Or one of my favorites is, I'm going to start that. I'm going to start eating healthy and exercising January 1st. Well, it's December 15th. Like, why don't you start right now? Like, start living your life right now. Move your body every day. And then I just love good old water. Drink water. Have it with you, carry it with you, pack it with you, have it in your car. Always have water. And it's easier to sip water throughout the day, for your bladder than just chugging it all at the end. Oh, I didn't drink any water today. And then get good rest and sleep. And I know sometimes for some of us that's a challenge, but I try to work really hard at getting a good sleep. None of my babies slept, so I don't think I slept for 5.5 years. But sleeping masks, blocking out noise, whatever you need to do is finding out your sleep regimen and what you need to go to sleep and then stay asleep. And then challenge your brain. This is something we haven't talked about, but brain's an organ. It's an important organ, and you want to use it. So going to YouTube and figuring out how to do PowerPoint really challenged me, but it gave me a good skill and it made me really think. So use your brain, challenge your brain, whether it's doing Jeopardy type puzzles or solitaire, whatever you can use, challenge your brain, and then eat real food. I can't stress this enough that what is out there, what we can buy at the grocery store, isn't always real. So eat the best real food that you can, and then always live a life of gratitude. I am truly thankful every day. Even days are a little crazy and chaotic and my kids screaming or whatever, but I try to live a life of gratitude. And that just helps set my mental and my emotional and then my physical as well. So I think that might be the end of it. Oh, I got 10 minutes. Look, I talk really fast. I'm the oldest of 4 girls, so we learned if you didn't talk fast, you weren't going to get it in.
I think that's it. Anybody
have any questions?
I had a question. I didn't put it in the chat, and it's probably, I don't even know if it.
Oops, sorry.
I'm muted.
Sorry about that.
That's okay. Anyways, so my question is, it's about joint replacement. Yeah. I have 3 joint replacements myself, but I have a friend who is having really bad issues with her hip. You know, we're the same age, and she says that she was going to try to wait, but she's in so much pain. I'm like, and given that it takes us longer to recover when we get older,
yes,
it just seems like it's not worth waiting for sometimes.
Yes. So, sometimes they want you to lose. So sometimes doctors say, well, I want you to go lose 20 pounds or lose 50 pounds, right? Because you're putting stress in the joint. But I have a friend and her husband had excruciating hip pain, and he had lost in the capsule of the ball and socket joint. You could see it was bone on bone. Like, it was excruciating pain. He had a hard time getting up off the toilet, getting in and out of his truck. And I actually sat with her in the hospital when he had the hip. And so when he woke up, he said, I only have surgical pain. I have no more hip pain at all. It is astonishing.
That was me. And I was like, is it the drugs or does it really feel this way?
It was life-changing for Bill. And I walk that walk with them. So sometimes all of this stuff I talked about, right, you get to a point where you're going to have to replace the joint, and they're really good at it now.
Mm-hmm.
30 years ago, they were kind of more challenging and their knees may wear out, but now they're really good at replacing joints. So if it gets to that point where that is, then yes, quality of life.
Yeah, it's like, yeah, I figured as much.
Have her give me a call. I'll tell her the Bill story. I'll have her talk to Bill.
Yeah, serious. It's the worst pain ever.
Mm-hmm. Any other questions?
Go ahead.
I have a question. I've been, I'm going to be doing a bone density test, and I've also been prescribed Prolia. I haven't started any of that yet. What are your thoughts on that?
Well, I don't really know very much about prescription medication, but bone density, get a baseline, get it, see what it is, and then you can make decisions about what kind of prescription medications, because there's always side effects to that.
Yeah, that's what I'm afraid of. So yeah, I'm getting a baseline.
Get a baseline, absolutely,
yeah.
yes.
Yeah. Okay, thanks.
But all these other stuff we talked about, do those as well.
Yeah, I was taking notes on all of that.
Do some planks.
Yeah,
Go for walks.
I can do that. So,
so what I didn't say is one of the most commonly fractured bones in women who have osteoporosis in aging women is the hip, but it's also the wrist.
Yeah.
Because when we put our hands down to fall. So do planks, strengthen those little carpal bones in your wrist.
Right. Okay. I'll do that.
Do some planks.
Thank you.
Cheryl had a question of where do you get bone density tests?
You often have to go, every insurance company is different, but often your medical doctor will then send you out, whether in Federway, who do we use?
Carol Milgard will do it in Tacoma.
Okay.
Yeah.
So there's lots of radiology places out there that will do it.
What do they do? What does this test consist of? Do we know?
I think you lay on kind of a bed.
Yeah, it's like a CT, MRI, but it's really specific at looking at the density of the bone. It's I'm going to say it's like a radiology study, but it's looking at the density of the bone, and it shows you.
Right. There's no pain to it at all. You just lay on a bed and they do some kind of machine. Yeah. Right. Yeah. So yeah, no pain at all.
Looking for my power cord. Oh, there it is. Cool. I'm gonna die if I don't plug in.
Dr. Yee, just share with us like the most why you became a chiropractic doctor. What drew you to this type of practice in your life?
So I was in college thinking I was going to be a teacher, but then I taught swimming lessons and I said, no, I cannot be a teacher. But I like to teach. And I like to, and my mom was a nurse and I loved medicine. But I also loved navigating kind of I was an athlete. And so I liked the natural aspect to healing my body, to learning about function versus just kind of getting a pill. And not that all medical doctors do that, but and it certainly medical school has changed where they talk about CBD now even in medical school. So things have really changed, but I wanted to be more in your face about changing your world, changing your life kind of about it. So that's kind of where I steered. My chiropractor said, well, why don't you think about chiropractor? It's great. You know, you can own a business. You can change people's lives. I love it. I personally loved it. So I thought, oh, this is something to look at. I did not have an epiphany at age 5. I'm going to be a chiropractor. It's just kind of this development of who I really was and then who I could become.
That's awesome.
So,
Cool.
Any more questions, you guys?
Yeah, are there calcium benefits in coconut and almond milk? I don't actually know what the calcium is like. You'd have to read the label. I know that it wasn't listed in anything that I've ever, unless it's fortified with calcium, because calcium in milk is the dairy. So that's why cheese and yogurt are high in calcium. Whereas I don't know if any nuts have showed up high in calcium or same as coconut. So Cheryl, I don't know, but you could see if it's fortified. Sometimes things out there are fortified. And there's a holistic option if the bone density meds have serious side effects. Well, so you're saying rather than getting the bone density test is what else can we do? Is that
no, the meds are going to have a lot of side effects. Are there things that we can do to fortify our bones? Like I see the collagen, the water-soluble collagen, and I hear pros, but then I read a lot of things that it is not effective when you ingest it. So what can we do to fortify our bones?
Weight-bearing exercises, calcium, vitamin D, those things will help make your bones stronger or as strong as they are now.
Got it. Thank you.
I think the thing that really struck me from your presentation is motion is lotion for your joints.
Oh,
I have
yeah.
We're just doing this right now.
anybody that is tweetable. Motion is lotion for your joints. That was me. You know, you always try to move every day and all that kind of thing, but just hearing you say that, it was just you know, just very, very impactful.
Kelsey just reported, of course, Kelsey. She has Almond Breeze, and it has 450 milligrams of calcium. So there you go, Cheryl.
Thank you. Oh, fantastic. And Kelsey, that is not calcium fortified. That's just regular almond milk, because I drink the same Breeze.
Let me see. My daughter drinks it. I don't drink it because I think it's gross. It says Almond Breeze, almond milk, unsweetened vanilla. Doesn't say anything about it being fortified.
Okay, awesome. Thank you. Thank you so much for checking.
I am not seeing anything that says that.
Okay.
It's just the one from Costco.
All right. Well, thank you so much. I sent you a private message too, Kelsey. Did you see that?
She froze.
It froze.
Me? Oh, no, I didn't see it.
Well, I'll let everybody know. I know we've got a few aerobics instructors here, but Janelle, did you see that the old 24-hour fitness in Puyallup is now becoming a UFC, and they're going to be having classes and stuff? So if anybody's looking to get, pick up a couple classes in Puyallup, it'll be good. And Doctor, I teach a class in balance.
Yeah, I'm hoping to work with them.
Love it.
Mm-hmm.
You guys talked over each other.
Sorry.
Go ahead. What'd you say at the end there, Cheryl?
Oh, I was going to say, Dr. Kim, I teach a class in balance. I absolutely love it. It's my favorite class in the world.
Where do you teach that then?
Well, it used to be LA Fitness and 24-hour fitness, but they've been closed. So now I've got an online fitness membership that I teach it at. And I've partnered with a company called Booty Kicker, where we can do all kinds of really fun stuff in it. And then I also do vibration fitness, which I absolutely love. What's your take on that?
Well, any kind of motion, right? Anything that you're going to stress the body is fantastic.
Good.
But send me that information so I can tell my patients.
Oh, will do. Okay, yeah, I will.
Yes.
Awesome. Well, it's been a great.
Yeah, send it to all of us.
Oh, I will. Okay. My favorite thing was just live a life of gratitude. For me, that is the best. It is absolutely the best every day.
Yep, every day.
And thank you. This was a great one. Diesta, thank you again for putting this together.
Thank you.
So if you send that to me, I'll make sure I'll send everybody out the replay of this. Some people couldn't get on when they wanted to because I messed up the host thing. You'll get to see the replay. Everybody come off mute so we can give Dr. Yee just a round of applause. But before we do that, Linda is on the call on the call today, and we will see her on Saturday morning at 9 o'clock. Awesome!
Woo,
awesome.
I
Can't wait. So
Thank you.
Dr. Yee, a round of applause. Thank you.
Yay!
That was great.
Thank you.
Gratitude.
So good.
Thank you.
You have to. Yeah, and I called Dr. Kim. Oh my goodness, in March I think it was, and I was like, I need you to do a Zoom event with me, and she's like, Diesta, I don't know what I could offer. I mean, and what she gave us today was priceless, and she was doubting that she had anything to share. And I was like, oh my gosh, she just gave us 18 slides worth of valuable information. And I had to talk her into it because she was like, I don't know if I have anything to share. Oh, wait a minute, get my pom-poms.
Dr. Yee, I want to say, so I'm doing mine in 2 days. You are much braver than I am. I don't have a single PowerPoint slide to do. I'm just going to talk. 'Cause I was
You're braver
take
because
that
this is my crutch.
I don't know how to do it, so I just gave up.
It's
Oh,
okay.
you guys are funny.
It's okay. It's okay. And Margie just talked on her part too, so it's fine.
I did.
And it's just being real with each other, and it's wonderful. You have so much to share, Linda. People are going to get so much out of your presentation.
And what is she talking about?
She's talking about. Go ahead.
Pelvic.
I'm going to talk about pelvic floor changes with menopause. So prolapse and
Yes.
Yes.
Awesome. Okay, we'll see you Saturday then.
questions.
Say the end of that, Linda. Say the end of that. People didn't hear it.
Questions. I want to hear your questions. If you've got questions beforehand even, and you can let me know so I can address them beforehand. But otherwise, I'll try and address questions as we go because I know it's something we all deal with.
Sounds good.
All right.
Okay.
Well, thank you, everyone. Dr. Yee, you did amazing.
Thank you.
Good information.
Bye.
Bye-bye.
Thanks, Teresa.
Bye.